You are the nurse taking care of a patient who is experiencing a panic attack. You are instructed to give the patient a dose of lorazepam. Which of the drug classes below describes lorazepam? A. Barbiturate. B. Alpha blocker. C. Beta blocker. D. Benzodiazepine. E. Amphetamine. The answer is D. Benzodiazepine. The correct answer is benzodiazepine, as lorazepam, also known as Ativan, is a benzodiazepine drug. Benzodiazepines act by increasing the efficacy of the neurotransmitter, GABA, when it acts upon its particular receptors. They have potent anti-anxiety properties, among other properties, and are frequently given during the initial phase of a panic attack to calm the patient. On the other hand, the other choices are incorrect. Phenobarbital is an example of a barbiturate. Propranolol is an example of a beta blocker. Tamsulosin is an example of an alpha blocker. Methamphetamine is an example of an amphetamine. Metoclopramide is used in the treatment for which of the following conditions? A. Ulcer disease. B. Tuberculosis. C. Chronic bronchitis. D. Vomiting after chemotherapy. The answer is D. Vomiting after chemotherapy. Metoclopramide is an antiemetic and gastroprokinetic agent commonly used to treat nausea and vomiting, to facilitate gastric emptying in people with gastroparesis, and as a treatment for the gastric stasis often associated with migraine headaches. Fluorouracil is used to treat which of the following conditions? A. Myasthenia gravis. B. Rheumatoid arthritis. C. Colorectal, breast, and ovarian cancer. D. Ulcerative colitis. The answer is C. Colorectal, breast, and ovarian cancer. 5-fluorouracil is a fluoropyrimidine analog which inhibits translation, synthesis, and function of RNA and DNA, thus slowing down cellular metabolism. It is used in treatment of colorectal, breast, and ovarian cancer, in addition to cancers of the GI and head and neck. Which of the following laboratory values would indicate toxicity in the client taking acetaminophen daily? A. Sodium level of 140 milliequivalent per liter. B. Direct bilirubin level of 2 mg per deciliter. C. Prothrombin time of 12 seconds. D. Platelet count of 400,000 per cubic millimeter. The answer is B. Direct bilirubin level of 2 mg per deciliter. A direct bilirubin level of 2 mg per deciliter or greater indicates acetaminophen toxicity. The purpose of misoprostol in a client who chronically uses non-steroidal anti-inflammatory drugs, NSAIDs, is a. Decrease in serum phosphorus level. B. Relief of epigastric pain. C. Reduction of steatorrhea. D. Increased white blood cell count. The answer is B. Relief of epigastric pain. Misoprostol is used for the prevention of non-steroidal anti-inflammatory drug, NSAID, induced gastric ulcers. Taking this drug will prevent gastric ulcers and relieve epigastric pain. Clinically, abdomen is divided into 9 zones. Epigastrium is the part of the abdomen immediately over the stomach. It is located between the costal margins and the subcostal plane. The epigastric, above stomach, region contains the majority of the stomach, part of the liver, part of the pancreas, part of the duodenum, part of the spleen, and the adrenal glands. During breathing, the diaphragm contracts and flattens, displacing the viscera and producing an outward movement of the upper abdominal wall, epigastric region. It is a convergence of the diaphragm and the rectus abdominis, so that when both sets of muscles, rectus abdominis, tense, the epigastrium pushes forward. It is also the spot where the Heimlich maneuver is able to produce a rapid and forceful exhalation of breath.
Which of the following analgesics is available in lollipop form? A. Hydrocodone. B. Oxycodone. C. Tramadol. D. Fentanyl. The answer is D. Fentanyl. Fentanyl citrate comes in solid form on a stick, often referred to as a fentanyl lollipop. This form is 8,100 times more potent than morphine and intended for use by cancer patients and patients that have become tolerant to opioids. Celecoxib is what class of drug? A. Muscle relaxant. B. Narcotic. C. Non-steroidal anti-inflammatory drug, NSAID. D. Corticosteroid. The answer is C. Non-steroidal anti-inflammatory drug, NSAID. Celecoxib is a non-steroidal anti-inflammatory drug, NSAID. These drugs work by inhibiting cyclooxygenase 1, COX-1, and cyclooxygenase 2, COX-2, which reduces the synthesis of pro-inflammatory prostaglandins and thromboxane. Which of the following is an antidote to opioid overdose? A. Naloxone. B. Flumazenil. C. Inositolcysteine. D. Glucagon. The answer is A. Naloxone. Naloxone antidotes opioid overdose by competitively binding to mu-opioid receptors. Flumazenol is an antidote to benzodiazepines. Glucagon is an antidote for beta blocker overdose. Inositol is an antidote for acetaminophen. Which of the following over-the-counter analgesics is one of the most common causes of liver failure in the United States? A. Acetaminophen. B. Ibuprofen. C. Aspirin. D. Naproxen. The answer is A. Acetaminophen. Acetaminophen in doses over 3,000 mg per day can result in significant liver damage or liver failure. From 1998 to 2003, acetaminophen was the leading cause of acute liver failure in the United States. According to a population-based report in 2007, there are an estimated 1,600 cases of acute liver failure in the United States every year, with acetaminophen being the most common etiology. Levodopa is not generally given alone due to what side effects? A. Nausea, vomiting, and anorexia. B. Delirium. C. Heart palpitations. D. Tremor. The answer is A. Nausea, vomiting, and anorexia. Levodopa, L-Dopa, a common treatment for Parkinson's disease, is generally given in combination with carbidopa or another peripheral dopa decarboxylase inhibitor. This is because levodopa alone will stimulate dopamine receptors in the GI tract and the chemotrigger receptor zone, CTZ, in the brain, resulting in nausea, vomiting and anorexia. A peripheral dopa decarboxylase inhibitor prevents levodopa from being prematurely converted into dopamine in the adrenal glands or other peripheral tissues. How does adalimumab function to reduce inflammation in rheumatoid arthritis? A. Cyclooxygenase 1, COX-1, and cyclooxygenase 2, COX-2, inhibitor. B. Tumor necrosis factor alpha inhibitor. C. Monoclonal antibody. D. More than one of these. The answer is D. More than one of these. Adalimumab is a tumor necrosis factor alpha, TNF-alpha, inhibitor. This class of drugs suppresses response to TNF-alpha, a potent pro-inflammatory cytokine. Inhibition of folic acid metabolism is the method of action of methotrexate. Reversible inhibition of COX-1 and COX-2 is the mechanism of nonsteroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen. Rheumatoid arthritis drugs such as rituximab, and almost all drugs that end in mab, including adalimumab, function as monoclonal antibodies. Which of the following analgesic medications should be used with caution in patients with hepatic disease? A. Acetaminophen. B. Ibuprofen. C. Ketorolac. D. Meloxicam. E. Naproxen. The answer is A. Acetaminophen. Acetaminophen, also known as Tylenol, is initially metabolized into a hepatotoxic intermediate. It transiently becomes a reactive oxygen species, which can cause liver hepatotoxicity. As such, in patients who already have pre-existing liver disease who are already more prone to liver injury from substances and diseases that affect the liver, it is prudent to avoid medications like acetaminophen that have a known potential to cause liver damage. Meloxicam, ibuprofen, naproxen, and ketorolac are all examples of NSAIDs. These medications have the potential to cause renal damage or gastrointestinal damage if used in excess, but do not have the known hepatotoxic properties that acetaminophen does. You are the nurse taking care of a patient who is started on a 2-week course of oral prednisone. Which of the following is a known side effect of oral steroids? A. Hypotension. B. Hyponatremia. C. Insomnia. D. Decreased appetite. E. Hyperkalemia. The answer is C. Insomnia. The correct answer is insomnia, as steroids are known to increase patients' vigilance and energy levels, thereby frequently making it difficult for patients to fall asleep and/or stay asleep while taking their steroid medication. The other choices are incorrect. Decreased appetite is not a side effect of taking steroid medications. Patients on steroids often have increased appetite. Hyponatremia and hyperkalemia both are not side effects of taking steroid medications. Hypernatremia and hypokalemia are more common side effects of steroids. Hypertension, rather than hypotension, is a known side effect of steroid use. You are the nurse taking care of a patient with severe lower back pain. He is being treated with oxycodone and hydromorphone. Which of the following analgesic medications produces dilated pupils? A. Mepridine. B. Morphine. C. Hydromorphone. D. Acetaminophen. E. Oxycodone. The answer is A. Mepridine. Mepridine, a potent opiate analgesic, also known as Demerol, is one of the only opioids that produces dilated pupils, rather than constricted, pinpoint pupils. A way to remember this is to remember the phrase, Demerol dilates. The other choices are incorrect. Acetaminophen has no known effect on pupil size. Morphine, oxycodone, and hydromorphone, all opiate analgesics, are known to constrict the pupils. Demerol dilates. Demerol dilates. Demerol dilates. You are the nurse taking care of a patient who is hospitalized for severe lower back pain. The patient also has a medical history significant for multiple gastrointestinal bleeds and peptic ulcer disease. Which of the following medications should be used with extreme caution in this patient given his medical history? A. Oxycodone. B. Morphine. C. Hydromorphone. D. NSAIDs. E. Acetaminophen. The answer is D. NSAIDs. This is the correct answer because NSAIDs are known to be irritants of the gastrointestinal tract, and prolonged and/or extensive use of NSAIDs can increase the risk of developing gastrointestinal ulcers, as well as consequent gastrointestinal bleeds in the setting of ulcers. NSAIDs reduce the production of the hormone prostaglandin. One of the things prostaglandin does is increase the production of gastric, stomach, mucus and substances that neutralize stomach acid. If there is too little prostaglandin, the stomach lining becomes more susceptible to damage from stomach acid. The other choices are incorrect. Acetaminophen is not known to increase the risk of gastrointestinal bleeding or peptic ulcer formation. Morphine, oxycodone, and hydromorphone are all opiate analgesics and are not known to increase the risk of gastrointestinal bleeding or peptic ulcer formation. The home health nurse reviews the types of insulin prescribed to the client diagnosed with diabetes mellitus type 1. Which of the following insulins experiences peak action between 6–12 hours? A. Glargine. B. Lispro. C. Regular. D. Isophene, NPH. E. Aspart. The answer is D. Isophene, NPH. It is essential for the nurse to know the onset, peak, and duration of actions for all types of insulin. Rapid-acting insulins Lispro and Aspart have an onset between 10 to 30 minutes, peak between 30 minutes to 3 hours, and have a duration of 3 to 6 hours. Regular insulin has an onset between 30 to 60 minutes, peaks between 1 to 5 hours, and lasts 6 to 10 hours. Intermediate-acting insulin Isophene, NPH, has an onset between 1 to 2 hours, peaks between 6 to 12 hours, and lasts 16 to 24 hours. Very long-acting insulin Glargine has an onset between 3 to 4 hours, does not peak because it works continuously, and lasts 24 hours. The answer is C. Tiotropium. Albuterol, terbutaline, and somaterol are all beta-2 adrenergic agonists. Beta-2 adrenergic agonists are a drug class used as mainstay treatments for respiratory diseases such as bronchial asthma and chronic obstructive pulmonary disease, COPD. They replicate the functions of catecholamines such as epinephrine, norepinephrine, and dopamine in producing different autonomic responses within the body. Beta-2 adrenergic agonist. They stimulate beta-2 adrenergic receptors, causing smooth muscle relaxation in the bronchial passages. Tiotropium, trade name Spiriva, is an anticholinergic bronchodilator. All of the following are examples of adrenergic agonists except dash. A. Terbutaline. B. Somaterol. C. Chiotropium. D. Albuterol. Which of the following is an example of an inhaled steroid used in the treatment of asthma? A. Somatrol. B. Fluticasone. C. Ipratropium. D. Chiotropium. The answer is B. Fluticasone. Fluticasone, trade name Flovent, is a synthetic glucocorticoid used in the treatment of asthma and allergic rhinitis. Chiotropium, trade name Spiriva, and ipratropium, trade name Atrovent, are both anticholinergics, and somatrol, trade name Serivent, is a beta-2 adrenergic receptor agonist. What class of drug is montelukast? A. Long-acting beta-2 agonist, LABA. B. Anticholinergic bronchodilator. C. Leukotriene inhibitor. D. Corticosteroid. The answer is C. Leukotriene inhibitor. Montelukast is a leukotriene inhibitor. It acts by antagonism of the leukotriene receptor sites in bronchial wall smooth muscle to prevent wheezing, chest tightness, and coughing caused by asthma, and to treat other respiratory issues to promote proper ventilation. Each of the following antibiotics works by inhibition of the 50S subunit of bacterial ribosomes except ASH. A. Macrolides. B. Clindamycin. C. Streptogrammin. D. Tetracyclines. The answer is D. Tetracyclines. Macrolides, streptogrammins, and clindamycin all work by inhibition of the 50S subunit of bacterial ribosomes. Tetracyclines have a similar mechanism of action, but instead affect the 30S unit of bacterial ribosomes. Polymyxin antibiotics target what part of the bacterial cellular anatomy? A. Nucleic acids. B. Ribosomes. C. Cell wall. D. Cell membrane. The answer is D. Cell membrane. Polymyxin antibiotics function by interfering with phospholipid function in bacterial cell membranes. After binding to lipopolysaccharide, LPS, in the outer membrane, polymyxin's hydrophobic tail causes damage to both the inner and outer membranes of gram-negative bacteria. What is the mechanism of action of amoxicillin? A. Interference with the 50S subunit of bacterial ribosomes. B. Inhibition of bacterial cell wall synthesis. C. Interference with the 30S subunit of bacterial ribosomes. D. Suppression of folate synthesis. The answer is B. Inhibition of bacterial cell wall synthesis. Amoxicillin inhibits bacterial cell wall synthesis by interfering with the formation of cross-links between peptidoglycan polymer chains. Which of the following class of antibiotics is associated with ototoxicity and hearing loss? A. Quinolones. B. Beta-lactam antibiotics. C. Aminoglycosides. D. Glycopeptides. The answer is C. Aminoglycosides. Aminoglycoside antibiotics such as streptomycin and gentamicin have been associated with vestibular toxicity and hearing loss. Aminoglycosides remain in inner ear fluids longer than serum and can have a latent ototoxic effect, causing hearing loss even after the antibiotic has been discontinued. None of the other antibiotics listed are associated with ototoxicity. Ciprofloxacin belongs to what class of antibiotic? A. Tetracyclines. B. Beta-lactams. C. Fluoroquinolones. D. Macrolides. The answer is C. Fluoroquinolones. Ciprofloxacin belongs to the fluoroquinolone class of antibiotics. Other antibiotics in this class include norfloxacin, levofloxacin, and natafloxacin. What is rifampin's mechanism of action? A. Disruption of cell membranes. B. Inhibition of DNA gyrase. C. Inhibition of RNA polymerase. D. Inhibition of the 30S subunit of bacterial ribosomes. The answer is C. Inhibition of RNA polymerase. Rifampin inhibits bacterial RNA synthesis by inhibiting RNA polymerase. This prevents the transcription of proteins within the bacterial cell, leading to cell death.